I'll bounce the question back to Chris, just because this is what I believe that Heart, Body, and Soul Inc. does. Its main mission is to raise awareness. When people say they're raising awareness, you're like, raising awareness for cancer. It's like, okay, well, we know it's here. We know it exists. Raising awareness. So this is what raising awareness actually is. Raising awareness for understanding there are screenings that you need to take, you need to do for your health to basically just understand where you are, like what's the baseline you're at. So what are the ways in which you try to raise awareness and let men understand these are the screenings that you need to do at these particular ages in order for you to understand what your baseline of health is?
So, great question, and thanks for that. A big part of what we do is making sure that we bring our hospital partners along. So the doctors are there so people can ask these questions, but we want to make sure they understand that regardless of what your income level is, regardless of whether you're uninsured, underinsured, or undocumented, there are services available for you to screen. And so a big part of the barriers for a lot of people that I interact with, especially Black men, is that, well, I don't have the money, I don't have insurance, or, my insurance, I'm not sure if it's going to cover it or something like that. And then, of course, I deal in communities where there are people who are immigrants who don't know that they have the option to even go in. So we really want to get that information out there so people know that regardless of what their status is, they can get these screenings. So you can get a colonoscopy. You can go and get a PSA blood test, which is prostate-specific antigen to screen for prostate cancer. A lot of people.
Wait, hold on one second here.
Yeah.
So the finger up the bum is not.
Okay, so I was about to say
that is the only thing that I can hang my hat on.
So here's the thing. So they call it a DRE, or digital rectal exam, right? So and this, I know you can speak to this as well. But the whole thing is with that is it's not an absolute necessity anymore. It is helpful to do.
Do you see my face right now?
Yeah, it is helpful, and there are doctors who still do it because doctors, especially the doctors who are more, experienced and understanding what to feel for and how to check for certain things, doing that is helpful. But you can get a blood test, which is a lot less invasive, and that can give you the results to determine whether or not you have prostate cancer or maybe at risk for prostate cancer.
All right, you hear that, guys? So now, look, you can avoid the finger up the butt, okay? In 30 years, they have not improved the technology to, for our mammograms, but boy, did they figure it out for y'all. They figured it out for y'all, okay?
Well, I'm hoping that they figure it out for women, too.
I want them to figure it out because this sucks, okay?
Yeah,
Thank God I have boobs to place in it. I don't know how A-cups do it.
That's what I was going to say. I have friends who struggle with that.
Yeah.
Wait, what?
It's
like I don't even know. Okay, but let me just ask this, just because I have to know.
Yes.
Maybe not you. Well, I mean, maybe you can answer. What are they feeling around for? Like, what? Tell me. I'm sorry. We are supposed to be serious right now.
No.
Okay?
Listen, this is fine. We need to, laugh about it.
But so, what does a normal prostate feel like versus one where it's just like, oh, you're in trouble? What? Tell me about it.
So first, we're sorry to steal your joy of just thinking of men going through the finger up the butt.
I'm sorry.
But really, the prostate is this small. They describe it as a walnut organ right there, and you get
Wait, hold on. Where is it?
It's right. Think of it as at the base of the penis, like deep in there, like where it starts.
Okay.
But you get to it through the anus. So you stick the finger up the butt, and you can feel it. You can palpate it. And if it feels smooth, then that's good. But if you feel some lumps, some unusual lumps there, then that's what's concerning. But
okay,
like Chris said,
now you can't get that with the blood test. All right, so it's tried, tested, and proven. Tried, tested, and proven. Okay.
That part is true. You can't get that with the blood test.
Can you imagine a female proctologist with nails like these? Huh? That would be a disaster, right?
It would be.
I did have a female proctologist, but
the nails are not like that.
Nails are not like that.
Okay,
No,
hold on.
no,
This
no.
is a total sidebar conversation. Who decides out of med school, I think I'm going to go into proctology? Who decides that? Like the doctors that I'm like, why? Proctology, podiatry, there was an endocrinologist. Well, not really, but they're just kind of weird sometimes. But proctologists, I've always wanted to interview one and say, how did you choose this as your field of specialty?
I like to think it's the intellectual curiosity of the organ.
Good way to put it.
I know,
Because
right?
I had no clue. So you just want to walk around and just stick your finger up people's bums and feel around in there. But hey, that could be considered like sadistic or whatever. I don't know. Thank you for that. I appreciate
You're welcome.
that. Okay. So Chris, having looked down, the barrel of, a gun basically, in terms of heart attacks, you faced death a couple of times.
Yes.
I have too, just once, but that was enough. How did it change your outlook on life? And I know that you said you found your purpose by starting Heart, Body, and Soul Inc. But how did that affect your, how you went about your living your life on a day-to-day basis?
I think I had a greater value for life, right? Because every day I felt like I think I was grateful, but I don't think I was truly grateful. I think I took a lot of things for granted. There were just assumptions made. I woke up, I'm doing this, and everything is fine. But you realize that when you have these near-death experiences, just how fragile life is. Like after having, I didn't tell you the sequence of events, but the first heart attack was 42. I got diagnosed in September of 2021 with cancer. October of 2021, I had my second heart attack. And then I had my third coronary incident in February of 2022 after having surgery to remove the tumor and do this whole colon resectioning. And then after that, in April, I had a serious blood infection that landed me back in the hospital. So it was all these events. And every time I was there, I said, any day now I could go. So I got to make up my mind how I'm going to live my life and live with purpose and live with intention. Now, it wasn't easy because there were days where, I was frustrated to no end because I'm like, what do you mean I'm back in the hospital again? Or what do you mean I have to be on this medication? What do you mean I have to start chemo now when I'm as sick as a dog? But, the end result is I could be here longer. The end result is I would have more time with my family. So I was just like, there's nothing to it. I got to do it. I have to. So I put myself in that mindset. And it really gave me I would say a stronger appreciation for life.
If both of you can answer this question about post-treatment care. For you, it was cancer and heart attacks. But talk about the post-treatment care for somebody who, it was an early detection. Maybe they had to go through a couple of rounds of radiation or chemo. But what does post-treatment look like for somebody who has survived colorectal cancer or prostate cancer?
Yeah, definitely. Chris's insight will be very valuable because I like to say it's easy for me to say, try with this, but I haven't experienced it. From my point of view, when I do see my patients after we've completed the chemotherapy, I would see them say within 3 months. And I noticed that they're not quite back to what they were before. We've been through like easily 1 year of treatment.
Chemo's tough.
It is.
I watched my mom go through it. Chemo is tough.
It is.
The best thing that they can do is keep their sense of humor, and also gratitude, but go on.
Yeah, it's tough. And we're trying to find ways to improve upon treatment without using chemotherapy. But it just takes the body a while to recover and get back. And some of the post-chemotherapy side effects that people have, especially from some of the drugs that I use, could be permanent. And the goal is really to try to minimize how much toxicity is permanent while we're still trying to cure the cancer and extend life.